Welcome to Neo Academia. I'm your host, Dr. Natasha Mott, and today I'm joined by Dr. Rohin Francis, a cardiologist, educator, the brilliant mind behind the popular YouTube channel Medicrisis. You see, Rohin and I met on Threads, where we enjoy a playful banter because he's not your typical physician. He's actually an interesting thinker. He's an artist, a comedian, and a writer, so we don't ever really stay in one lane on this episode, but what else is new? This episode is possible thanks to Theory Gang Substack subscribers and, of course, our sponsor, Big Nerve. I've been working with Big Nerve for a while now to develop a community of innovative, creative thinkers, and their goal is simple. They want to recognize and fund creative thinkers. They're trying to create an entire new profession of innovation where catalysts like me could ask interesting and engaging questions, and innovators like you can answer them. There are many different ways to play. You can ask questions, answer them, rate answers, mentor answers. All of this earns you points. At the end of the month, these idea tournaments pay out to the top 30 participants, and everybody gains some more experience points and gets known for their expertise. This game is meant to elevate creative thinkers and their ideas. To join my team, you'll have to click on the Big Nerve question in the Theory Gang newsletter, where each episode I'll design a special question relevant to the guest and discussion. All right, here's the episode. Now don't forget to listen all the way to the end for the question.
Dr. Francis, how are you?
At your service. Yeah, no, I'm good, thanks. How are you?
Good. You're supposed to say Dr. Mott. You're supposed to say that back.
Oh, beg your pardon. Yes, Dr. Mott.
Honestly, I'm sick and tired of this shit. I'm a doctor too.
I know you don't really ever mention that. I only know that from your email signature.
Yeah, no, I don't like to say it because I think it brings about a false sense of authority.
Yeah, I agree. I like to ride that authority and utilize it. So I just throw it out there all the time.
You're right. I was checking out your website and I really like it. I'm inspired now. I'm like, I need to do a website. It's good medicine, bad jokes. Really good. Really.
Oh, that's not been updated for a while, but good. If it still passes the test, that's fine.
Yeah, it does. I think it's absolutely true. Good medicine, bad jokes. I think it's really, your jokes are really bad.
Thanks. But at least I'm accurate then with my tagline.
Right. And I think bad jokes are mostly truth. Like that's why they're bad, because the part that's funny is when something's like a half truth, you know?
Yeah, I mean, I think medicine is an interesting field to make jokes in because you can easily stray off what is kind of acceptable. So I probably play it fairly safe a lot of the time.
Yeah, you do. You do. Unlike me, I play fast and loose.
Well, that's good too. That's good too.
Well, I can though, because there's no like malpractice for me. Like even if I'm like doing science, there is no such thing as like scientific malpractice. So like,
yeah. Although I would say that it's quite hard to really get any kind of significant blowback from a regulatory body for stuff you say online. I don't really feel that's the concern. I would hate for a patient to see me saying something in bad taste. So that's kind of more what I mean. Like I don't want to, it kind of comes back to that authority bias and everything. I feel like I have to maintain at least some kind of decorum, but I'm happy to make fun of myself. So that's the safe one.
well, self-deprecating humor is always safe. But like also, let me ask you this then. If your colleagues start to think you're an asshole, like is that more or like just as important as if your patients think you're kind of goofy?
Yeah, I mean, that's a good question. I think if you're saying it's sort of goofy, then I don't really care what my colleagues think. I mean, they probably already think I'm goofy. But if, I think what was the word you used to begin with? Like an asshole or something. Yeah. So that's different because obviously asshole can kind of have more negative connotations. So, you never want your colleagues to think you're a jerk. But I think once you lose trust of your patients, then I think you're, really going to struggle. So yeah, I think I'm not too bothered what my colleagues think of me, as long as they don't actively dislike me. But I wouldn't want patients to get a bad impression.
Well, but okay, so maybe I used the wrong words of being flippant, saying, asshole and goofy. What I really mean is you don't want your colleagues to think you're a quack, and you don't want your patients to mistrust you. And I mean, because I'm assuming that's what the big hurrah is about Andrew Huberman right now is like everybody thinks he's kind of giving quackery online, right? Would you say that's accurate?
Yeah, well, I don't know if everyone thinks that, but I think there's a fairly large contingent of medical professionals who think that a lot of what he says is inaccurate. I don't think there's anything unique about him, but he's the biggest medical kind of podcast influencer, if you like, in the world at the moment. Certainly has the number one health podcast. So I think it's reasonable that a fair amount of attention is directed at him. But I think he's a very interesting kind of case to look at because for me it was quite apparent early on that a lot of what he was saying was not based in science, but it's taken quite a while for a lot of people to come round to that um, conclusion, and I think it's because he very successfully does something that we normally associate with a very different kind of group of people. This kind of cheerleading for science and like, wow, isn't this amazing? And this study showed this, and that study showed that. And I find it quite interesting because a lot of the people who kind of hang off his every word are fundamentally opposed to that kind of yay science crowd. But I put him in the same category, really. It's just this kind of credulous, overly credulous, non critical look at science. It's just he's talking about ice baths and, saunas and stuff. And the people, the kind of yay science crowd, I mean, they talk about lots of things. They talk about physics or whatever. But, in the last few years, I think it's been particularly the pandemic that has created a bit of friction in between these camps. So for me, it's all part of the same thing, this kind of cosplaying of science, which I think depicts an equally misleading image of what kind of, I mean, at least medical science, I won't speak for science as a whole, but at least medical science, it gives this kind of slightly artificial impression of what actually is involved with, developing medical treatments or things like that.
Well, I think there's this notion the only people that can really develop medical treatments are like pharmaceutical companies. Like, if you don't become a pharmaceutical company who does all the things, crosses the T's and dots the I's with the regulatory bodies, then you cannot be considered serious in your pursuit. And there's a lot of people who are very much against this at this point. Like, who's the guy? Now I'm going to forget his name. Biology. Shravanasan.
Oh my
Yeah.
gosh, right. I don't Okay, right. I don't know much about him. I just know that tweets all kinds of rubbish.
Oh, he talks all kinds of shit, especially about NIH. And part of it I consider, right? Because as a scientist who's dealt with NIH, I've dealt with FDA, like I understand the rigmarole and the bullshittery involved in these regulatory bodies. But this argument that he has is that the standards are too rigorous in some places, and then they completely don't work in others. Like one treatment I'm thinking about for Alzheimer's disease, the monoclonal antibody against beta amyloid, aducanumab, is that the one I think? Like that shit don't work. And it went through FDA and got approved.
Mm.
Like, what say ye, Dr. Francis, about this kind of shit?
Yeah, I mean, I think there's a kind of like biology talking about, things are too rigorous. So that's just classic crypto bro,
It's true.
hyper capitalist, like we shouldn't have any regulation. And I don't put any credence in that kind of perspective. I don't know the story of aducanumab so well, but I know that it came to market with really no decent data. And that's not unusual. I think there's a huge amount of money that drives a lot of the kind of pharmaceutical industry, and the FDA approving something doesn't necessarily mean that it works. It just means that they feel it's not unsafe. So I think that's sometimes a source of confusion, that FDA approved doesn't necessarily mean that it's sort of going to enter into guidelines or it's evidence based. But
Is,
you know,
did the EMA approve aducanumab?
I don't know actually. I mean, I've it's not my field, but I've not heard of it being prescribed here.
Because
Um,
EMA is much more rigorous from what I've seen in my experience. Like they're kind of no bullshit. They're like, let's see how y'all fare over there first, and then we'll. That's why all the pharma companies do their trials in Europe. It's not just Europe; they do it everywhere because y'all have been exposed to less than us.
Yeah, no, I mean, I think there is night and day differences between a lot of how these treatments come to market between the European market, and which that the EMA was based in the UK until Brexit, unfortunately, versus America. And I think a lot of that is driven by the very different healthcare systems that we have, and of course, particularly in the UK, which is completely public funded and there's no free at the point of access versus a European model, which is slightly different, where you'll have kind of insurance, but it's capped. So you're really not paying that much. It's still socialized medicine, to use the American term. Uh, but in both mainland Europe and the UK, the emphasis is on evidence and value for money. So therapies come to market, come to be used and sort of are guideline based with much more rigorous bar. And on the whole, I mean, there are exceptions, but I think to go back to your original point about kind of drugs or therapies that don't work, I think it's way more common than people realize. And there was a sort of big not meta-analysis really, just a study looking. I think it's been a while since I looked at it, but I think they looked at 2,500 medical therapies of all the kinds of
Yeah.
description, operations, drugs, and these kind of things. And it was, I hesitate to say the exact numbers, but it was somewhere in the ballpark of a third having good quality evidence,
Yeah.
and then something like another third having kind of shaky evidence, and then the remainder having really minimal at all. And I think this comes as a real shock to people, how poor a lot of the evidence, particularly for things like operations. People assume that, drugs maybe, there's a bit of a softer indication, but there are quite invasive procedures, operations. The classic examples are
The BBL.
BBL. I mean, the results are plain to see. So I think you don't necessarily need a randomized controlled trial. You just need to see if
But the safety,
the ass looks good.
yeah, not the
Yeah, no,
efficacy.
yeah. Um, no,
Although the
exactly.
efficacy, I don't know. Have you seen some of these girls? Like, I don't know.
Yeah.
I look
Well,
worse. I probably seen more.
there's subjectivity. Beauty is in the eye of the beholder, etc. But yeah, no. So I think safety is a slightly different thing, and safety can be ascertained without bigger trial or something. For efficacy, you're looking at something different, and you do often need a very sufficiently powered big study, which is hard to do. So a lot of the time you get these kind of bullshit kind of mechanistic studies or preliminary data. And if there's enough push, if there's enough excitement, and there's a whole kind of hype train, at every level, from the research lab itself to the university that brings out the research to the press that often are completely scientifically illiterate and report on these things, and then people like biology who want to invest loads of money in this new thing, and it is like everything else. It's kind of driven by these forces. I was saying that people might think that drugs, they may be less surprised, but even for operations, you will find that there are stuff being done to hundreds, thousands of people. And if you dig into it, there's really no randomized data that it works. And
Mhm.
there are these things called medical reversals, which is where a therapy is found later down the line to be either ineffective or worse, harmful.
For example, like tonsillectomy. Like when I was a kid, they
Yep.
were just giving them things out for free. They were like,
Yeah.
"Yo, you take these ones, take those ones." And then when my kid came to get her tonsils out, granted they were huge, and I think they were a little too restrictive. I was like, "Bro, take these shits out." Um, but they were like, "Well, she had strep 6 times in the past 12 months." I'm like, "Yeah." So I mean, I understand there's a cost to benefit of these things. But I think this is where the problem is with medicine and in the utilitarian ethic of like treat everybody as the same, treat everybody as the statistic. I mean, that's why you get all these Andrew Hubermans rising up. All these, I saw your video kind of bitching about what are we calling it now? Functional medicine. Bitching about these people who claim to do personalized medicine because they are willing to sacrifice some of the statistical accuracy to personalize things for you. Like, for example, like my kid getting her tonsils taken out. She had struck like I think 4 or 5 times. And I was like, I'm not waiting anymore. It's a chronic condition. So someone from a personalized or functional medicine approach should be much more willing to sacrifice that statistic and go against a guideline, I think, than your standardly trained medical doctor. Would you agree?
No, I wouldn't.
No?
No, I think a good doctor should, and guidelines are guidelines. They're not sort of set in stone. I think a good doctor should always be able to exercise some discretion, and otherwise you're not doing the job properly. And I
Right.
think functional medicine has sold itself as like this kind of separate entity. But my point is that functional medicine and the kind of pillars, if you look at the kind of Society of Functional Medicine and what their pillars are, is that that's what a good doctor should be doing. That's just good medicine. Now,
Good.
if you're saying that do all doctors do that? Of course not. And I am the first to talk about all the ills that affect modern medicine. I'm very well aware of the shortcomings, and I think that's the kind of thing that leads to the functional medicine taking off, and this kind of idea that this is a untapped new philosophy that we should personalize care. I mean, that is what being a doctor is personalizing care. If a patient comes in with an identical symptoms, two different patients, um, I'm not always going to do exactly the same thing because I'll sort of see, just talking to the patient, getting a vibe. A lot of that stuff is not scientific. It's just based on experience and the kinds of cues that you pick up. So I would, I think that the functional medics like to claim that, but
Mhm.
but it's nothing new.
Mhm. And so you're a cardiologist. You do surgery. Do you do surgical stuff?
Yeah, like stents and stuff like that.
Okay.
Good.
But I feel like a lot of cardiologists have a deeper, I don't know if it's like an interest in physics or some kind of the doctors go into different specialties for different reasons. But I've always found cardiologists to be more thinkers than a lot of other specialties. Like oncologists are algorithmic because there are so many molecular variables. They're like, check, 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 go for this 7-in-1 treatment, blah, blah, blah. But cardiologists are like, I think they're really thinking more mechanically, more holistically. So, could it be that the different specialties in medicine may have like a differential kind of problem with their personalization? For example, the worst, I think, of all is the GPs. The GPs are like, you know, um, bring them in by the boatload and spit them out the other end. I think. What do you think about that?
I mean, I don't know a huge amount about family medicine in the US. I know that there are a lot of similar pressures here, and I think I'm always very reluctant to be critical because it's a tremendously resource poor setting, and I
Mhm.
think GPs um, go into the field with the best intentions to be a generalist. I really love the kind of general side and try and
Mhm.
maintain that as best I can, even though I've specialized. But um, I just think it's completely unrealistic in the system we have here, and I think the US is kind of similar. I know that family medics are the lowest paid. It's the least desirable field to go into because I think they feel that that there isn't much sort of resource for them. But here, what I was saying in that video that you saw was the average consultation in the UK is 7 minutes long for a
Yeah.
GP, which is a
Mhm.
10-minute slot, but then they have to spend 3 minutes doing the paperwork and all that stuff at the end. So the actual time with the patient is only 7 minutes. And that's terrible. That's terrible for the doctor. That's terrible for the patient. You're not going to get anything sorted in 7 minutes unless it's the most straightforward problem. And of course, people are getting more complex. The population's getting older. They're more comorbid. Everybody has multiple medical problems. So you can't explore the things. And, so when a alternative medicine practitioner or functional medic, lifestyle medic, when they say, I really listen to the patient and explore, their entire dietary history and talk about how much they're exercising and all these kind of things. It's not that doctors and GPs don't want to do that. I think GPs are more aware of that kind of stuff being important than someone like me in my ivory tower in a hospital. But I think they just don't have the bandwidth to do that. And which is why, one of the reasons people go into this is not just to be quacks and grifters or anything like that. I'm not at all suggesting that people interested in this field have bad intentions, but I think a lot of people get disillusioned by the system that they're in, and they see this, and I've talked to a lot of the kind of lifestyle medic um, people. Obviously, it's very overrepresented on social media, and I ask, what drew them to this, and it's just like, it's just kind of seems cooler. It seems more interesting. And if you can spend half an hour with a patient and charge them through the nose for a private consultation, then of course you can talk about more than you can do in 7 minutes. So I think it's just not comparing like for like. I mean,
Mhm.
coming back to your point about different types of people going to different areas of medicine, I think that's true. I think, cardiology has historically always been one of the most competitive. So you probably have people who are more academically minded. Most of us go into postgraduate research. I did a PhD, and that's kind of the norm. So I think that self-selects. But GPs probably is the most heterogeneous. I've forgotten how to say that word now. Heterogeneous.
Heterogeneous.
Yeah,
Yes.
right. I just haven't said it out loud for a few years. Um,
Heterogeneous.
yeah, maybe. Who knows? But the most heterogeneous group probably is GPs, because it attracts all kinds of. It's a more flexible job. For example, you could maybe work 2-3 days a week and still have a stable career. Whereas for me, that would be a bit weird. So I think maybe you can't. It attracts all types.
So what's the problem with the functional medicine in lieu of a GP? Like, if you think about what you're going to get from a GP in 7 minutes versus what you might get from like a functional medicine kind of a GP, are you afraid that they're going to, and they do, it does tend seem this way, that they're kind of like offering non-evidence based solutions or testing or procedures to kind of up the bill so they get paid, or because they think it's cool. And so the question is like, are these people practicing evidence-based medicine as much as like your 7-minute GP who's highly efficient? Is that the main concern?
Yeah, I think that's another sort of good question with kind of a complex answer. I think um, there are plenty of people who would label themselves as practicing functional medicine who are perfectly rational and reasonable and do sensible things. Um, but it's a kind of gateway drug to a lot of non-evidence based beliefs. So again, coming back to the kind of pillars of functional medicine, exploring social indicators of health, trying to find out, are there things in somebody's life, do they have a stressful job? What's their socioeconomic status? How does that impact their health? As I said, diet, exercise, these kinds of things, social interactions. That's all totally reasonable and absolutely important to somebody's health. But what functional medicine can also lean into is that we have more agency over our health than sometimes maybe real. And I think a lot of the people who inhabit this space and follow this stuff online, they're all pretty comfortable middle class kind of affluent people, where going for some forest bathing, infrared sauna or something is probably great, and it's nice. But if you're telling the kind of single mother of three living on a council estate, you should practice a gratitude journal. I mean, like, how's that really going to help? So I think it can lead to kind of unreasonable expectations of what these interventions can actually achieve.
Mhm.
Um, and it can lead on to non-evidence based practice. So, you've got your kind of gray area of things like acupuncture or something like that, right into, full blown kind of madness. And where are the fields who are the kinds of people that will often end up with a functional medic? Are people who've been disillusioned with conventional
Yeah.
medicine. And who are the
Right.
people who are disillusioned with conventional medicine? Typically people who have conditions that are poorly treated by conventional medicine.
Right.
And
Exactly.
yeah, so, and I'm not going to suggest that, like, that's why I say I've never have anything against a person, a patient who seeks an alternative. Because if you have something like chronic fatigue syndrome, long COVID, um, all kinds of chronic pain disorders, and you go to your GP and they're like, well, we've tried paracetamol, cocodamol, and maybe do you want to try some stronger morphine or something? It's not because they're not trying, but there's just not much in the armament. I mean,
Right.
painkillers really are, not very effective overall,
Right.
or they come with a lot of side effects. So if somebody wants to look for something else, fair play to them. I think that's fine. I just don't like them being taken advantage of, even if the person doing it isn't necessarily aware that they're doing it, because they are also just not able to appraise what they're talking about. And you get this a lot with kind of dietary advice. You get
Right.
GPs who look up, just watch a bunch of videos about the keto diet, and then they're like, bang, bang, bang. They've labeled themselves like the keto GP is their Twitter handle, and it's just like keto for you, keto for you,
Right.
keto for you.
Everything. You get a keto. You get a keto.
And it's like, if one thing treats everything, then it's a pretty sure that
Right. Well, the
it's
panacea
beings.
is
Yeah.
is always snake oil thing. I feel like traditional medicine, you go to the doctor, you ask for something and they're going to be like, no, the evidence doesn't go. I've had this happen. No, we're not doing that. Or the guidelines don't state this, blah, blah. I feel like it's like asking Google a question. You're like, hey, Google, what did I ask it earlier? I forget what I asked. I asked it about a pronunciation of something. It's like, I'm sorry, I can't help you with that. And then
Hmm.
I went to ChatGPT, and of course it's wrong, but I'm like, I still was able to ask it, and it was able to give me a more nuanced and interesting answer. Where I feel like a lot of traditional physicians are literally just parroting back, and I do think that in speaking of AI, moving forward, this algorithmic kind of treatment pattern is going to be useless. Like, you'll be out of a job if you're just going to feed me back what the guidelines say. I could go read the AHA guidelines. You know,
Yeah.
what do
Yeah.
I need you for? So if I say differential diagnosis, I come in with this, take this test. Okay, took the test. The interpretation of the test is X, Y, and Z. Okay, next step. I mean, bake me a cake, doc. Like,
Mm.
what's the future of medicine then?
Yeah. I mean, I think that I fully agree with that, actually, and which is again comes back to my point that I don't think that's what a doctor should be doing. If they are purely just parroting algorithmic, you know, treatment, and you present with this, so we do this test, then that's not a good doctor. So the nuance is understanding how to interpret a test. So I think a lot of people will have the impression that medical tests just give you a kind of yes no answer, whereas that's pretty much never the case. So you know the number one thing that I'm consulted about, of course, is heart disease. So if somebody comes in and they've kind of got a little intermediate risk, then I'll book a scan. It doesn't come back. I mean, occasionally it's like plumb normal, fine. But then even if it's plumb normal, if the patient's still having symptoms of exertional chest pain, then if I just say, well, your scan's normal, go home, bye, then it's like they haven't actually been helped. They've still got a symptom. So then that's my role at that point to try and think, what else can I offer? What else can I do? Or if the test comes back with some sort of intermediate response, which is quite frequently the norm, some result that's not necessarily 100% normal or abnormal, then you've got to put that into context. And I don't think it's as hard as I think people, patients are human beings, so I'm pretty sort of open with them. I'm saying, look, the test says this. I'm not 100% sure if it's necessarily the right thing, but we've got this option. We can just repeat it in a year or two. We can just forget about it and you come back if you have symptoms, or we can do another test. And I think that's the role of a doctor, is to, and this has been a big movement in recent years to come away from the paternalism
Hmm.
of 30 years ago. But I think it's swung too far the other way. So I think a lot of my generation, or perhaps even the younger generation, it's swung to like almost surrendering the entire decision making process to the patient.
Hmm.
And saying patient empowering the patient is great, but you can't just dump everything on the patient. You have to be able to advise them. So I'll say, look, we have all these results. Here are the options. What are your thoughts? And if the patient says, well, what do you think, doctor? And most of the time they do. Most patients are not the kind of hyper online podcast listening people. They're elderly. Most patients are over the age of 60, 70, and they're like, doc, you tell me. I'll do whatever you say. That's the average patient. And so they're putting trust in you. And that's when you have to exercise some kind of um, judgment. You can't just say, "Well, the guideline says this, so bye, you're going to be discharged."
Hmm.
You then you have to make a recommendation, and I think that's what maybe some of the younger doctors aren't so familiar with, because we've had this drummed into our head that we shouldn't be paternalistic, and we should be um, involving the patient in care, but that has led to them sometimes giving very complex decisions to patients and their families, which I think is totally unfair, because they don't necessarily understand everything that's involved in that. For another example, less to do with kind of drugs or tests or anything, but a absolute howler when I was a junior doctor, when my boss, who's not the younger generation, she was talking to a family about their patient, their loved one who was very sick and massive heart attack, and saying that, talking about resuscitation, and saying it's your decision. I can't make that decision for you. Whether to resuscitate your father. And I'm like, that's not correct. It's a medical decision. You should
Oh,
never,
interesting. So
you
you
should.
think a DNR should be the physician's call?
Well, no, I don't think it should be a unilateral thing. But I think that was completely unfair to dump that in the family's lap, because their dad was unconscious. He was intubated on a ventilator. How can they weigh up all the different things that
Yeah, they
go
have no
into that
clue.
decision?
Right.
Hypoxic brain injury, how long has had a cardiac arrest for, all these kinds of things. Every family, if you say, do you want us to resuscitate your loved one? They'll say yes. If they say no, they'll, it'll haunt them forever. But if they say yes, and then the dad has a horrendous resuscitation attempt, and cracked ribs, and a drain put into his chest, and all this kind of, repeated shocks and stuff like that, that'll also be
And then no
unfair.
functionality after that.
Yeah, so exactly. And I just think I winced so much. I was quite junior then, so I didn't say anything, but I did talk to the family afterwards, and I just these are the kinds of decisions that we need to share, not just dump on a patient or the family.
But
But
that's the question of ethics and morality, not science.
sure, no, but that's what my point is, that I think doctors are not just passive vessels of science. I think
Good.
we should be.
Fucking is so boring. We agree on everything. Like, this
Yeah,
is annoying.
I think that was always a danger.
Damn. What do you want to? Well, can we fight about some shit? Like,
I'm sure we'll find something. Yeah, or I can
I
just.
mean, I feel well, even online, I feel like so. I think I saw you first on Threads. I meet you
Yeah,
on
I
Threads.
think it's one of the few things I've gained from Threads, to be honest.
I give some laughs, that's for sure. But Threads is a weird place.
Yeah, I feel like it's become the anti-Twitter, which is not a compliment.
No.
Um, they're both just doing my head in different ways.
Yeah, it's a separate kind of hell for sure.
Yeah.
Um, so, but on Threads, I feel like we haven't really disagreed about too much, except I'm gonna take this like epistemological anarchist role on. Although I think I'm probably a lot less actually like that, but I play that on TV or whatever. Um, but I think and you take this like kind of like you know, uh, by the book, but also kind of funny, even kind of persona online. And what I've found, the type of people, now we're going to get into a social media discussion, but I found like the type of people who follow you are super annoying. Like, they are I mean, gosh, they're insufferable. insufferable know-it-alls is all
I
I'm gonna
don't
say.
know if they're necessarily people that follow me. That's the way Threads works. Is often people reply to me and I look at them, they don't follow me, and I'm like, how did you even see this? Like it's just all kinds of random. But I think you're right. I think I've been earmarked in that
Yeah.
group, so I think that my posts get shown to a lot of
Yeah.
those people.
Insufferables. Yeah.
Yeah, there are plenty of insufferables.
Yeah. See, I
That's
fucking love science. What did you call them? You call them the yay science people. It's
yeah.
the people who clicked follow I fucking love science on Facebook in 2008 or whatever. Like I did that actually, but I've had this crazy turnaround, I think. But then the people that follow me are just mostly insane, it would seem, you know. So it's a different position to be in. But I feel like we've had some disagreements on threads, haven't we?
Yeah, probably. I mean, maybe one was about the whole Huberman thing, so we can always return to that if you like. But it was, I think, you were saying, why does it piss me off so much? And
Yeah. Why does it?
well, I don't think it does.
'Cause he's hot, right? Because he's a big hot.
No, I mean that's why like I'm researching a video about medical podcasters, and it's becoming this kind of behemoth, massive thing, and I've got no time, so it's taking months and months. But I was, I've got a little passage in the kind of beginnings of the script saying that I'm quite happy that it's Andrew Huberman as the number one because he's very nice to listen to. He's got this kind of this rich kind of bourbon
Like him.
voice.
You're a
And
fan.
yeah, no, of course, I'm very aware of what social media is, right? Social media is not awarding the most accurate scientist. It's awarding someone who people warm to, who they appreciate. And of course, he's easy on the eye. He's popular with men and women. And yeah, for a podcast medium, I think he's got this fantastic voice. So, that these are all things that are just the way the world works, and that doesn't upset me in the slightest. But it does also make me aware that we are dealing with an influencer.
Mhm.
This is not like some scientist. And when this is what I wouldn't say anything pisses me off. Nothing really pisses me off. But when Time Magazine calls him, the man who like popularized science or something like that, or
Oh
made
no, he's with Carl Sagan.
made America fall in love with science again, or something insane like that. And when every signs off all his posts with "Thank you for your interest in science," I'm like, this is the IFL science. This is the same thing. It's like, whoa, science, and isn't science amazing? And it's
They're the
like,
rogue ones. They're the ones who defected, who got kicked out of that group.
I don't know. I think they just kind of they've got it. It's just a different personality type.
Yeah.
He's more and this is why I follow the kind of bro science world so much, because I think that's me as well. Like I like all those same things. I like to do a lot of the same stuff they talk about. I just don't kind of go on about it online because coming back to your first point, and this is one of the things I'm going to say in the video is if you're taking advantage of the authority bias that comes with being a scientist or being a doctor online, which we all are, I am too, like absolutely. If why is somebody listening to me versus anybody
Marketing.
else?
Yeah.
Yeah, it's because I've got a medical qualification. So if you're taking advantage of that, which Andrew Huberman is, introducing himself as a neuroscientist and professor, then you've also got to take the responsibility that people are going to treat your opinion differently to a layperson. So, when he says, I haven't been vaccinated for flu or something, that's fine. He's allowed to say that, but he's got to understand that his opinion and him saying that is going to affect people, views because they see him as this authority and
You think he
science.
doesn't you think he doesn't know that or acknowledge that?
No, I think I don't know if I mean I'm sure he knows that, but that's my point is that he takes and a lot of the other podcasts as well. The biggest in the UK is this guy called Rangan Chatterjee, and again it's all the same mo. Is they'll say something, and then when people say, yeah, how can you promote this, and he'll say, hey, I'm just saying things. I didn't tell anybody not to get vaccinated. I just said I'm not vaccinated. I mean, that's, and it's the same kind of cop out every time. And, I hate these social media terms like dog whistle or whatever, but,
Mhm.
he does talk about a lot of things, which like fluoride in water and stuff.
Mhm.
He's obviously aware that there's this huge conspiracy theory and kind of all tinfoil hat wearing people who go on about fluoride in the water. It's not a legitimate concern from any scientific perspective. But then, he kind of talks about it in this kind of roundabout way. And if you analyze each statement, he's not saying like fluoride is going to kill you. But he
Right.
then immediately says, well, I've just, invested in a yerba mate company, which is made with guaranteed no fluoride in the water. And I endorse this. And that's his sponsorship. And I'm like,
That's
wait,
appealing to your audience. That's business, bro.
oh, sure. But then don't tell me it's science. This
Oh,
is
but did he?
no, but I'm saying that is the perception that everything he says is scientific.
Oh,
Every
yeah.
every time I say something critical of him, and I've never criticized his personality or anything like that, his politics or anything like that. If I object to something he said, people go, "Wait, Andrew Huberman." No, I understand you're criticizing these other quacks, but he's very evidence based. He cites
Yeah,
studies for everything he says,
he
and I'm like,
does.
yeah, but he that doesn't mean anything. You know as well as me. You know as well as me that I don't know, 80% of published medical stuff is horseshit. It's
That's
you know,
that's the soundbite right there. That's the sound. Or my best.
I mean, especially since COVID days, like
Yeah.
I can't remember now, but I counted, I tried to do as rigorous a search as I could, not including the preprints, right? So
Uh-huh.
just stuff like on PubMed, like 2 years into the pandemic, it was something like 125 or 185,000 papers had been published on COVID. Are you kidding me? Like, is there that much science?
No, there's that much money, honey.
Well, it's not just necessarily money, just like you guaranteed a publication, right?
Yeah.
So no matter what your lab was, I mean, I had, all my academic friends who are doing research, and I want to be a little sympathetic here because their labs got suspended, so they couldn't necessarily do other stuff. So everybody suddenly pivoted to COVID. I had friends who are cardiologists on like the national news talking about COVID trial. I'm like, I know this guy. He's a moron. Like, what's he talking about? Why is he on TV? And everybody pivoted to that because you knew you'd get funding, you get
Yeah.
publications straight away, and most of them are just complete rubbish. They shouldn't. They're not even
That's what I'm
worth.
saying. Like, that's what I'm saying, though. And I mean, that's why I was so critical of any kind of policy being made based on this disease very early on, because it's a science having the authority that it does in our society. It becomes a self-fulfilling prophecy. Like you talk about COVID, then you get more money to talk about COVID, and you get more money to I mean, it's like it's same thing like when people talk about I think John Horgan's going to come on my podcast next.
Oh, nice.
But
Yeah.
he's got this big write up about talking about racism in science. And he's like, "Oh, we should just ban it." I'm like, "You said to ban it. Now we're going to get more people saying why we shouldn't ban it." I mean, it's going to open up this huge can of worms. And you have to understand in the attentional currency that we have, like you set one thing on fire, it's going to burn bright for everyone. Is that really where we need our attention right now? And it's not. I don't think that. I mean, there are so many more interesting things in medicine to talk about right now than COVID,
Oh
right?
God. I mean, I've been ready to move on. I think I got to say, like, as an outsider looking into the US, and I say this to friends of all persuasions who are different kind of viewpoints on the pandemic when it was happening, but it looks totally alien. Like when I look at friends in the US, like somebody the other day posted on a group I'm in about a festival that's happening, an outdoor festival, um, which is the first time it's happening for a few years, and they said, "Oh, it's the whole event's going to be masked." Um,
Wait, what
and
state was it in though?
I don't want to say the specifics, but I don't know the
The
state
West Coast.
actually, but
It was a blue state.
I don't know, maybe, but so the one person posted the whole event is masked, and I know that person, and I think that they did it in a kind of neutral way just to gauge the response. And then the response was, "Oh, that's so good. I wish more festivals did this." And then the next thing was, it's not just a regular, surgical mask. It's a N95 or KN95 only event outdoors. And I was telling my friends who were the most pro-mask people, at peak pandemic, I was saying this is what my friends were saying in America. And they're like, what is this reality? Like Europe is not like this
Beautiful.
at all. Like we just have to have, we seem to have far less of it. Of course, we have right and left and liberal and conservative and all that stuff here, but it seems that there's far less polarization and division between the two sides. To in 2024 to be having an N95 mask event outdoors, it's completely
was-
unheard of here.
That's because the entire pandemic was usurped from its scientific purpose to suit political ends. Because there was an election, because Trump was up for election, and basically anything he said was going to be no, this is dumb. So they had to take all of these positions politically and say everything Trump says is dumb and bad. And he says you don't need to wear masks. He's the worst.
But he was pro vaccine. He was taking credit for the
He's
vaccine.
pro vaccine, right?
So
But he was not
but
pro
how?
mask.
No, but how does that explain? I mean, I agree. I think of course there was a lot of politics tied up in it, but that was the interesting thing that, if it was just I'm going to do whatever opposite of what Donald Trump says, the vaccine thing didn't fit in. I mean, maybe that's because there was a pre-existing anti-vaccine kind of sentiment amongst the right wing or whatever. But yeah, I mean, I don't know. Clearly, that I think it's people signal their tribe with all different
Yes.
ways, and pandemic became another way to
Well,
express that.
But before you move on from that, let me just say that the Trump derangement syndrome, like the people who support Trump or the people who are indifferent to him, they don't care what he says. They're like, yeah, cool, great. If it suits me, great. The people who hate him, they'll find any reason to go against him in whatever reason. So, but the vaccines, obviously, they're going to go according to what the left is saying. The left is also saying get the vaccine. So they'll be like, all right, but as long as Trump doesn't say nothing about it. So I mean, it really was in the United States hugely political, and that's why it's persisting even to this day.
Yeah, it does feel like the US hasn't moved on, and this I think is one of the aspects of Threads that I found strange. Is it feels like it's very much that crowd.
Yeah.
COVID isn't over, et cetera, which is a sound. COVID is still happening. Sure, of course. I have patients in my ward every now and again with the COVID infection. But to claim that it's anything comparable to 2020 or 2021 is crazy. Like it's a very different disease now. We're in a very different situation. I don't understand the necessity to try and claim that we're still sort of in this peak pandemic.
I think it's because politics can't be wrong. Science can be wrong. Politics can't be wrong. Politicians can't be wrong. So when you identify with some political symbol, you can't go back on that. You can't go back and be like, oh, I guess we didn't need to do that. No, it's now a part of your identity. And I think the other thing about Threads is, yes, those are your friends. And those are like your people who like your shit. The people who like my shit come straight over from the memes. Like I'm an edgelord, meme lord kind of like Threads person, right? Like I get all the fucking weirdos. Like I don't have the dorks. I have the straight psychos.
I think my crowd is the dorks. Like, I am that kind of from that science background. I go to nerdy events.
Bro.
Nah, but
so literally have dork dad on your website.
Yeah, well, there you go. But so I do feel like that is my crowd. Like I don't have stuff in common from a kind of my beliefs and things with the other side, so to speak. But this is where I feel completely, like I don't fit in with a lot of these beliefs, and that's why I kind of stay mostly quiet these days. That's why I left Twitter almost a year ago. I don't post in a big way on Threads. I'm increasingly feeling like I don't belong in these camps that have formed, which is normal. Like I think we shouldn't have to fit into certain polarized spectrum, but so I'm sure there are a lot of people in the same, they're probably the
There
people that
are.
aren't online. So,
I think, and I'm gonna say this to you, I don't want you to take this the wrong way or like in a weird way, but like I think you're more of an artist. Like, I mean, looking at I was like, following you or whatever, and I saw you like this giant YouTube and I watched some of your videos. I was like, he's a fucking writer, dude. You write, you act, and I think there's something about artistry, and I'm really interested in science and art and how they're kind of coming together in a lot of ways. And I read this Francis Bacon quote, like, no, not Francis Bacon, the science Francis Bacon, the other Francis Bacon.
yeah.
And it was that the role of the artist is to prolong the mystery. And I thought about the role of the scientist is to solve the mystery. And I feel like it's coming together into this weird asymptotic thing. But I think when you don't really know how to quite assemble your thoughts and feelings, you make art. And the art is kind of representative of those things without being overly explicit. And I really appreciate that about you. So I
Oh,
think maybe
well,
these
thank you.
explicit platforms maybe aren't your bag. Like where you have to statement, like
Yeah.
that's maybe uncomfortable for you.
No. I take that as a compliment, and thank you. I think I do come from a writing background, and I feel like the videos are essentially just essays. That's again like why I don't necessarily feel like I fit in with a lot of the medical creators who are much more like, here's a fact, here's a fact, here's a fact, like this is a fact, this is really interesting. Oh, this, and I'm like, okay, that's got a place, and people want to learn that stuff. But for me, it's more like, this is an interesting thing. I'm going to talk about it for a while. You make your own decision, make your own mind up about it. But
Mhm.
the art thing, I'll tell you something that's quite funny, because one of my best friends isn't like a full-time proper artist, and I was telling her about the festival with the masks, and how strange it is that the US is like this, and she just thought, she was like, yeah, what's wrong with that? And then it became apparent she thought I meant like a Eyes Wide Shut mask festival, like it was some sort of big orgy or something. And she's like, yeah,
Huh?
that's normal, yeah.
Well,
So
6KN95s like that.
no, when I explained Kane, and then she's like, oh right, okay. I thought it was
That's
like,
weird.
so um
Funny.
yeah, we talk a lot about the comparison between science people and art people, actually. And she
Yeah.
was saying how the nerds in our field, the nerdier they get in science, the lamer they are. Whereas the
Yeah.
nerdier, the kind of more extreme they get in art, the kind of cooler they are. Like they're
Yeah.
kind of just completely off the wall.
Yeah.
So the more kind of deep into your field you go, which I think I'm being a little unfair about science, because that's my kind of crowd. So I
It's
feel,
dry. It's just because it's so dry. Like, I mean, if we can dissect everything down to the molecular level, it becomes not only esoteric, but like esoteric in a bad way, like in a way that nobody fucking cares kind of way. Where I think there is so much information out there. Everybody says, like, oh, it's all about curation now. I think that's so right. But I think it's about curation and like weaving in and out of knowledge as well. Like, what knowledge is cool to know and what knowledge fits together in an interesting way. Like, that's fucking cool. That's creativity. Just being like, here's all the things you can know about this vertical. It's like, fuck off. Like, I don't care.
yeah.
And
I mean,
yeah.
I think we're probably both guilty of uh, not guilty, but I think we're probably both subject to a lot of selection bias with the kinds of stuff we see. I think there are a lot of very thoughtful, artistic souls in science who are communicating in a really interesting way. I just think that modern social media isn't necessarily promoting those voices so much, and I'm trying to get back in. I mean, I know you do a lot of book stuff and book reading and book clubs and things like that. And I'm trying to get back into that as well, because I feel like when you get sucked into the kind of content creation mill, and then you start viewing everything like potential content, and
Yeah.
you don't just actually enjoy something for the sake of it, just out of interest. So I've started trying to read science type stuff, which isn't going to be anything that I'm going to use in a video, just purely to start familiarizing myself and exposing myself again to the really expert science communicators and people who can get these ideas across in a way that isn't just boiling them down to the kind of molecular level and, like you're reading a textbook. And yeah, I know it's been a recurring theme, but why not? And that's why I think that's what I feel people like Andrew Huberman do,
Yes.
because they obsess about the mechanisms. No, and if you've seen any of the Q&As he has, any question, he'll immediately go off on some tangent which isn't really relevant about dopamine and neurotransmitters and nerves, and I'm like, wait, that isn't the question, but that's not what they were asking. And it's this kind of focus on the mechanisms that I think then you miss the whole bigger picture. And like promotion, like I was saying, I do enjoy a lot of the stuff that they talk about. So say something like a sauna, if or an ice bath, it's perfectly reasonable to say, and perfectly, it's not something that should be criticized, to say that you get great value in having an ice bath. You enjoy it. You feel better. You don't need evidence to say, you don't need a randomized controlled trial to say, I feel like $1 million after I come out of an ice bath, which is fine. But they don't stop at that. They go, well, this trial of 3 rodents showed that there was some, cytokine. Yeah, well, you never know. I mean, they're subjected to much worse. But, this cytokine was changed by 0.3%, or the heat shock proteins after a sauna. I'm like, fuck off. Like, can't you just enjoy something? Like, why do we have to boil it down to this kind of pseudo-scientific level? So that's
the
my
artist in you. That's the artist in you. We don't like it. I know this, but I think this is the constant battle of the artist scientist, is like, how much should I break it down? How much evidence do I need? Can I just go off of this feeling? Where is that distinction? Like, where is that line? And it's so arbitrary. But I think people like Huberman do that because they're being called upon to do that. Like, I think he feels the pressure to do that.
I don't have a lot of sympathy for that. I mean, nobody's pressurizing him to do any of these things.
I'm just saying, like, not on him, it's on all of us to explain yourself. Well, how does that work? Why does that work? And maybe even it's imagined or perceived that we're being told we need to have rationale for this. It's like, no, I fucking like it, dude. It's just,
Exactly. Yeah.
that's not very sciencey of you, that I think here's the other thing. I was thinking this the other day. I just watched this terrible movie by, I didn't want to call it terrible. It's not good. By Adam Sandler, called Spaceman.
I fell asleep.
Because there's a space spider who's very existential and helps him understand everything he's going through. And in the movie, for some reason, I had this thought that I was like, astronauts are kind of everything. And we used to really, really admire astronauts when I was growing up, because they were scientists, engineers, like they were athletes. I mean, they were everything. But nowadays, like, it's the stay in your lane. You're a cardiologist. Stay in your fucking lane. Don't talk about bicycles. Okay, fine. If you relate it to the heart, fine. But like, don't be artistic. Don't do some weird Western film. And this is the part I don't like, and it moved me out of science, because I am like very much a bumblebee moving from interesting flower to interesting flower. Like, I don't like that shit. And I feel like that's what these nerds want us to do. They want, like, your nerdy people who like you want us to be that. Tell them no.
I agree, but I think maybe I would push back slightly in saying, of course, people should be free to go from flower to flower with their own interests. And, I think that's entirely healthy. I guess what the criticism is that then if you appoint yourself as some kind of expert in these things, then that's, I think, where the stay in your lane comments come from. Now, just do some stay in your lane comments come from a bad place of like, don't question my authority, you don't know anything about this? Of course, there are people making these kind of criticisms. And I think there is a way to do it. I'm not an expert in all the things I talk about on my channel, but I'm not trying to be an expert, right? I'm not trying to say, this is what I do, this is how you should do it. I'm not giving prescriptive advice. Whereas I think a lot of these health podcasts are very much that, you must get 6 minutes of staring into the sun, then do 3 minutes of this and 4 minutes of breath exercises. It's like, so I think you're on a slippery slope when you're starting to advise people And that's when I think it's reasonable to say, hang on, what's your experience in this field? And do we want to live in a world where everyone can only focus on their tiny area of expertise? No. But do we want to live in a world where we've got a few influencers who all go on each other's podcasts and ask each other about everything on the sun, under the sun? Bec- because, when an expert comes on a podcast, they may be an expert in, this tiny little field, but the host is going to ask them about all kinds of different things. And then,
I'd
they
rather that. If we have to choose, I'd rather have that. But also, why do we have to choose? I feel like this is a false dichotomy you're setting up. Why can't everybody have an opinion about everything and then you decide what to talk about? Because for me, for example, what do I have on my actually I changed my threads and all my like descriptors. You said, well, all these people are neuroscientists. So I said neuroscientist,
yeah, I saw
writer,
that. Yeah.
podcaster. But like if I want to talk about fucking something in economics, like I just talked about the TikTok ban and how, this what committee it's in and how I don't think it's actually gonna do anything. Um, I should be allowed to fucking talk about that. And my argument is because we're all forced to brand ourselves. We're all forced to be in this personalized brand. I have to tell you exactly who I am in 3 words. And that's the fucked up part is being pigeonholed into that. If I wasn't pigeonholed into that, I could say whatever I want. But like, what am I supposed to have a separate, now a separate social media to talk about random shit just as a person? I mean, that's the part I don't get.
Yeah, I know what you mean. I mean, when I like on all my social media accounts, except YouTube, I talk about anything I want. I talk about politics and India and history and food or whatever. I think that's normal. I totally agree with that. But I think what people fail to understand about um, these kinds of influencers is that they think, so you see the doctor in front of somebody's name and they're talking about health, and people assume that they know what they're talking about, whereas we all know a whole bunch of doctors online who just talk rubbish. So um, I agree, it's a false dichotomy. I'm not saying that it's an either or, but I feel that there is some validity to questioning somebody's expertise in a field when they are depicting themselves as an authority, as an expert. And I think there is a way to talk about these things without saying that I am an expert in this field, but I don't think any of these podcasters have that degree of insight, or they are quite happy to just to give that impression falsely.
But it's a podcast.
Yeah.
They're not contractually obligated. They didn't take the Hippocratic oath. They didn't swear up on, on a Bible. Like, I mean, it's one thing for you to tell your patient who you were talking about in that story that had long COVID, and you were like, I really wanted to tell her, give her some like soothing, non evidence based treatment, but I didn't. And I'm like, why couldn't you have just been like, hold on, let me take my Dr. Francis hat off and tell you something on a personal level? Why is that not okay?
Well, so that in a patient setting, then I am subject to the regulatory body in this country, the GMC, or whatever, where there are strict guidelines, and I can't knowingly tell a patient a falsehood. That's one of the
Oh, but
fundamental.
what was the falsehood, by the way? What was the falsehood you wanted to tell them? What was the thing you wanted to tell them to do?
I can't remember what it was in that context, but some kind of like,
Phenomena or whatever, like you said.
yeah, something like that.
But it's not a falsehood if you tell them there's no evidence for this, and this may very well be a placebo effect, but you'll make feel good. That's
Yeah,
not a falsehood.
no, that I do say. I do say that. I will be honest and say, look, but I don't want to say something like, oh, I had a patient who did it and they got better or something like that.
Right.
Even if I have, because I think that is giving the wrong impression. There is a way to do it. You can say, as you said, I can't promise that this is evidence based, and I do that even with drugs. I mean, I'm not saying just with alternative therapies. I do that even with prescription drugs, and I think a lot of the stuff we prescribe, again, if you dig into the evidence, it's often not as convincing as people think.
Right.
So I will tell a patient that, look, I can't guarantee this drug is going to make you feel better, but let's give it a try. If it doesn't work, come back. We'll try something else. And that I feel that's, you know, kind of again, I feel that's the role of a doctor. But what I was limited by in that consultation was giving false hope. I don't want to do that. And I don't want to give an impression that something, particularly if it's, if it's like going for a walk in the forest or whatever, fine. But if it's some kind of gizmo or something that they've got to spend money on, I don't want to sort of put that in their head that this could be the answer to their very challenging problem when they've already tried lots of other things. So your point about somebody on a podcast, I agree. They are not, and a lot of these people don't see patients at all, or they're not medically qualified in the slightest. So yes, they're not subject to these kinds of restrictions. Doctors are. If you are registered with your medical body, again, you can't say incorrect information. But that comes back to what I was saying at the beginning, that I just rarely, if ever, see a regulatory body, except maybe in Australia, where they seem to be a bit more geared up to this, come down on a social media influencer for saying something inaccurate. To be honest, I think you can just say what you want these days. They're so stuck in the past. So, you're not regulated by that same doctor-patient relationship. And I think that's what leads to the frustration from medical professionals when they see people saying these things that would get them in hot water in a clinical context with kind of just abandon online and giving these ideas to people. Then I think it's frustrating, and that's what frustrates me as well. Is that I don't like people being misled.
Well, I mean, I think this is an opportunity. This is what I always think is, I think everything is an opportunity here. And I think physicians have an opportunity to think about what's being said and to counteract it. Because I mean, Will, how many people have come into your practice and asked you about something they heard on a podcast?
Not big numbers, but some, sure.
Some. And I mean, maybe you didn't have the answer at your fingertips, but did it then make you kind of go look at it or evaluate it in some way?
Sometimes, sure. I mean, we've had this before podcast with Google, and those like mugs that you'll see is like, don't confuse your Google search with my 10 years of medical study or something. And
That's
I
the
mean,
dorkiest mug I ever fucking heard of, dude.
yeah, I mean, when I first saw that, I was like, I thought people must be sharing this ironically, like it's kind of some cringe thing.
They meant it.
No,
Shares
no,
that
people
with
have that.
pride, whoever that is.
Yeah, people have it as like on their social media and on their Instagram or whatever. And I'm like, you really not understood, like what any of this is about, like. And so people would bring, like, of course, are there annoying patients? Yeah, of course there are. I'm not going to be some holier than thou person claiming that no patient has ever come in sort of with a whole bunch of preconceptions that they've got online, which is challenging to go through. But when patient came in with a big printout from Google, it's only threatening to me if I'm setting myself up as that I know everything.
Mm-hmm.
Whereas if I say to them, it's like, oh, that's really interesting. Look, I'll be honest, I haven't heard about this because this is quite a new thing that you've read about, in the Daily Mail. And as soon as I'll pass a judgment on what publication they've taken it from. But I don't feel you lose any credibility at all. And I don't think most patients want their doctor to be some kind of, absolute professorial know-it-all. They just want someone human who's going to talk to them, who's going to understand what they're feeling, and then try and figure out a solution. So I never got threatened by people bringing out printouts from Google or now bringing up some worksheet from Peter Attia or Andrew Huberman. I'll just say, and I mean, if it's those two, I've probably already looked into it. But
listen,
I'll say, and again, never judgment directed at the patient. But I'll say, look, actually, this I wouldn't spend much time on this for X, Y, Z reasons. This is not really applicable to you. And most of the time that's patients just want somebody to bounce the idea off. So I'm not bothered by that. I think that's again just part of being a doctor. What I struggle with most is where I don't have an answer. And that's kind of what I was talking about in that story, is, you can do them as much emoting and sympathizing and empathizing as you like. all of this stuff that I've said that makes me sound like I'm some sort of very nice doctor, when at the end of the day, um, if I still have nothing useful to suggest at the end of all that, then I've ultimately failed. It doesn't matter that I've
Oh
been
no.
no, I mean, it doesn't matter that, you know, that what they're looking for is an answer, right? So
Yeah.
that's what I think is a real struggle, and
Yeah.
that's
Well,
what,
I
yeah,
mean,
that's
that's
what.
that's exactly what I've said we need to teach doctors how to deal with is the unknown. This is why I think we need more philosophy curriculum. Like, did you take any philosophy in your medical training
No,
besides ethics? Not ethics.
no philosophy. I've kind of read a bit about it since, but that's purely kind of just out of interest.
See, this is right. A lot of interest, I can tell, right? But I think these are the things we need to deal with. These are the things, and I'm so glad like this is how we're going to end this podcast because this is, I left science, move and went straight into reading philosophy because I was just like, I can't fucking figure it out. This shit's, I'm never going to understand everything. I started reading philosophy, and philosophy is just kind of like, yeah, yeah, you're not going to figure it out. Let's figure out how to deal with that, you know? And I think that's what you're looking for. Like, I think that's what a lot of doctors are looking for. And I think that's why the Andrew Hubermans, the functional medicine, the alternative medicine, this is so irksome to physicians because they've been trained to hold life in their hands and to make decisions that are life and death. And then when you kind of got some decisions that are just like ether, you're like, oh, fuck, what do I do here? I'm God. I'm supposed to fix, die or survive. And I think that's really where physicians could benefit from dealing with and holding the unknown.
Yeah, I mean, I think a lot of people struggle with uncertainty and the unknown, but I would say that the podcasters are the ones who are offering the false
Oh, they're
certainty.
fucked up. Yeah, they're
You know,
fucked up.
and I think that's why they appeal, because I
Mhm.
sit there and I hedge my bets and I hum and ha and go, well, this may work, this may not. And if somebody goes, hey, this colonic irrigation, this is going to work, it's going to fix you, it's going to sort you out, then obviously that's going to be more appealing than someone who's being, you know, unsure about their assertions. So for sure, I don't, I think that is quite common. I don't think I'm some
Yeah,
exception. I think
right.
I think most doctors do understand that, and certainly a lot of the people that I've encountered in real life and online, I've learned from others, um, are very good at that. And
Mhm.
and dealing with that uncertainty. And again, this is my criticism of the whole medical influencing world, is it overcomplicates health massively. Like, I
Mhm.
think we should all be spending far less time thinking about our health. I don't mean we should not pay attention to it, but I think the things that you can do that are very high yield for your health is pretty simple. Exercise, eating healthily, not smoking, sleeping well, having good social interactions. You don't need a 3-hour podcast every week dissecting the finer details of all this kind of rubbish. You just need to get out there, enjoy your life, just
Yeah,
remember these main messages, and that's it. My goal with my patients is for them not to be thinking about health, and not, most of my patients are sick, right? They're not the kind of worried well that tends to be obsessed with all these podcasts and blah, blah, blah. They actually have medical problems.
yeah,
And I'm a secondary care physician, so
sure.
they've already been referred to me by somebody else, or they've come in as an emergency. Um, so my role is to get health off their mind, so they can just go and do the things they want to do, whether that's gardening or traveling the world or whatever. For me, it's like productivity, the
Mhm.
productivity world, which is another world I feel completely alien and sort of makes my skin crawl. I feel like it's just a medical manifestation of that. It's like, oh,
Mhm.
we should be optimizing this, and
Time hacking.
you
Yeah.
know, f- just
Mhm.
just
Yeah.
forget it,
There's
man.
a I mean, there's a philosophical reference for this as well, like the gestalt, like the
Oh,
inframing, the optimizing everything. And I think what these people really need is existentialism. Like they need to because they just want to prolong my life for what? For
mm,
what are you going to do if you prolong your life, if you maximize your efficiency, if you do all these things? It's like, what are you doing? You're going to continue to prolong your life and maximize like ad infinitum? What are you actually doing? I mean, so, there's a lot of questions to ask and not a lot of answers to be had. And I think we have to just be cool with that. We can't just continuously be like, oh, people like me and you are going to keep trying to answer questions because that's just our bag. That's what we do with our life. But I don't think regular everyday people really want that. I mean, Aristotle thought different. Aristotle thought, yes, they did. All people want to know. But I mean, do you really think that? Or do you think
No.
people just want to like play with their kid? And, I mean,
Yeah, I agree. The latter. Yeah, I think,
yeah,
I don't think
as
people.
we should.
Mm.
Mine's home from spring break right now. I should probably spend time with her.
Well, I plunked mine in front of the TV.
Oh,
So,
really? How old's your kid?
5 and 7.
Oh, 5 and 7. Such
Yeah,
a
yeah.
fun age.
Yeah, nice age.
Yeah. Well, then, I don't want them rotting their brains for much longer. So I suppose I'll let you
Oh,
get
I
back.
only play them Andrew Huberman podcast. So,
Excellent. Or your own YouTube channel.
no, they're like, nah.
Have they seen any of your?
Yeah, they've seen it. I keep them well away from that entire world. I'm going to
Oh, wait.
maintain their innocence as long as I can. But
Yeah, good luck with that. I mean,
Yeah.
my kid's now critiquing my essays and stuff. She's like, like she's 12, so she's got
Wow.
stuff to say about my brand. I'm like, dude, I enjoy the next few years before that happens.
Yeah, well, I mean, even though I try not to expose them to any of this, I caught them the other day, like, making a video to my wing mirror of my motorbike. Like, that's the camera. And they'd laid out their toys, and they're like, "Hey guys, welcome back to the channel." All in Bengali, that's our mother tongue. And they're saying it, and like, I'm like, where do you pick this up from? Like, they clearly, it's just in the ether somewhere. And so they'd already got the YouTube, hey guys.
Hey guys.
And and then they know about Prime, like the drink and everything. Like,
Not Prime.
Yeah,
They're done now.
they're done. I know. I mean, so
They're ruined. These
Mm.
kids. Well, I mean, no, 5 and 7 is an interesting and fun age, and it's totally different than even like 10 or 15 years ago when you had a 5 and 7-year-old. It's like the world of the internet has changed everything forever. So,
yeah.
Thanks for hanging out. Here's the big nerve question. How can we incorporate philosophy and existentialism into medicine appropriately? Head on over to bignerve.com to submit your answer and see what others have to say.